Good evening and welcome. Thank you for joining us today. Let me first say thank you to our panelists who today have made time in their busy schedules at a time when I know you are all doing extra work to come and be a part of this town hall. We believe that communication in these times is very helpful, and so we thank you for making that time. And I'll say thank you to those of you who are watching online, to those of you that tuned in to make this a priority, to stay involved and help in what ways you can. I'm going to begin with prayer. God, I thank you for these leaders. I pray that you will give them wisdom and energy and courage in this incredible time of need. I pray that when we fail to follow their leadership, that you would convict us and remind us how important it is that we are doing our part to be a part of our communities as much as we can. And when they give us instructions that are difficult for us to hear, that we are tempted to shy away from following them, that you will give us the courage to do our job in following in the best way that we can. God, I pray for those people in our community who are feeling some extra anxiety and some extra fear as a result of what is happening in our world. We pray that you would give them peace and that you would give them hope in this time. For those people we know that are sick, for those people who are dealing with COVID-19 on a health level, God, I believe that you are the great physician, and we pray for your healing hand to be with them today. And we pray that you will be here with us today, that you would give us the words to say, and that we would communicate clearly, and that those listening would listen intently. We love you, and we thank you. In Jesus' name I pray, amen. Before I get started, I just have one announcement. You may have heard that there is a blood shortage. Here at New Life, over in our youth building at the Landing, we are going to be doing a blood drive Wednesday and Thursday. Would you please visit newlifegillette.com and get more information about how you can donate blood to be a part of the solution to this problem in our community today. And I also just want to say, how amazing is it that we live in such an incredible community where so many of our leaders will make time in their schedule to gather together to make sure you are informed about what you need to be informed about. And so we're incredibly thankful to them for coming, and we're thankful to you. It wasn't too long ago, and probably many of us still are, where we're complaining about the disunity, about the fighting, about the division in our country. And I optimistically have this belief that maybe this issue, this problem in our country could actually have a positive benefit if it will allow us to unify, if it will allow us to come together. So let me invite you, those of you that are watching and our leaders, to focus on unifying in this time. Focus on loving our neighbor and doing what we can. And we've seen so much of it, and that gives us optimism. Allow that optimism to turn into action in your own life. Now I'd like to introduce to you the panelists who are here today. I will start on my far left. Dr. Patel is at the Campbell County Public Health, and he is an officer there. Chairman Deej Reardon is the chairman of the board for Campbell County Commissioners. Miss Ivy Castleberry is Public Informations Coordinator at Campbell County Commissioner's Office. Miss Jane Glosser is the Executive Director at Campbell County Public Health. Mr. Gino Palazzari is the Communications Manager for the City of Gillette. Dr. Nahida Khan works with is a Doctor of Geriatrics and Internal Medicine for the Campbell County Health. Dr. Attila Barabbas is Chief Medical Officer and Urologist for Campbell County Health. And Dr. Alex Ayers is the Superintendent of Schools for the Campbell County School District. I'd like to now give a few of our panelists an opportunity just to make some opening statements, and we will begin that with Chairman Reardon.
Thank you, Mike, and thanks to New Life Church for inviting us to come to you guys and talk to you, and thanks for the public for tuning in. This is a very serious issue that we're going to be talking about tonight, and hopefully we can get the word out to everybody of how serious it is and what we can do to start slowing this thing down. I want to thank the other panelists that have joined us tonight. There's a lot of good, experienced people here that I think can cover a lot of the different questions that have been presented to the panel, so thanks to them as well. Like I said, this is a very serious situation that we need to get a handle on. Campbell County is working hard to get a handle on it, and I think that once we do, and we are working on it, we'll come out of this thing, as you said, a lot stronger and in pretty good shape. So we just need to keep working on those things that the CDC, the public health, have recommended, including social distancing, hand washing, all of the other recommendations. So it's a kind of a hidden enemy that we're fighting here, but we need to get a handle on that. The other thing that I would say and ask is that people please check on your neighbors, check to make sure that people are safe. When you do go out to the gas station, the grocery store, be thoughtful, be kind, and especially be patient with the other people around you. If you've been to the grocery stores, you've seen that the aisles are starting to empty out, but please be patient, be kind to the people around you, and we can get through this together. Thank you.
Absolutely. Thank you for that. Dr. Ayers will now turn to you for some short words.
Good evening, Pastor Wilson. I wanted to thank you for inviting the school district to the town hall meeting tonight, so thank you to you and New Life Church. We really appreciate that. I'd also like to thank the communities we serve for their support over the last week. It's been trying, and but we really appreciate that support. And finally, I'd like to express my appreciation for Campbell County Public Health. That staff has been available to our district each and every day over the course of the last week, so thank you.
Absolutely. Dr. Kahn.
Thank you, Pastor Mike, for inviting us and giving us this opportunity to serve the community with you. And I would like to thank the people for joining us tonight. Thank you for trusting us with your time. So I would like to just share some information about the coronavirus. So this virus as a family has been around for a long time, but the strain that is causing this pandemic is new. So there is a lot of information that we're learning every day. So learning process through observation in terms of what's happening around the world, in other countries, and also in our neighboring states. But there's still a lot that we don't know yet. So the recommendations that we're sharing tonight is based on the information that we have today, meaning Sunday, March 22nd. So what does that mean? Come tomorrow, next week, next month, those recommendations may be tailored based on new information that we learn. So I know that for some people can create a cloud of uncertainty. So uncertainty, change is never easy. No one likes change. It creates anxiety, fear. But what I would like to urge all of you, like you said, patience, kindness, and following the recommendation. That's how we are actually going to flatten the curve and actually conquer this. So by the grace of God and following the recommendations, this too shall pass. Thank you.
And that is a great transition. I'd like to now allow a couple people the opportunity to give us some information of some go-to sources where we can go as information does change. Where can we go to get that information? I'll start with Ms. Castleberry. If you could give us, where do we go if we want to find out what's going on in the county and some decisions that are being made there? And do you know of any other central locations for information that we should be going to?
Thank you for asking that question, Pastor Mike, because as you mentioned at the outset, that communication, good, clear communication is key to helping relieve some of that anxiety that the public is feeling, as well as keeping them up to date as those changes do come about. One of the things that we observed early on was that the recommendations were to follow the CDC. They have their website. It has a lot of information. Sometimes that information, you have to kind of dig for it. And so what we did is we used our website and we established a number of web pages to really try to condense the key aspects of the message that the CDC had out there for individuals, for businesses, for schools, faith-based organizations. And so we have that centralized on our website, which is ccgov.net. And you don't have to have anything, you don't have to remember any extra pages, because if you just click on the initial landing page, there's an image and it says Campbell County COVID-19 information, and it'll take you directly to those pages. In addition to highlighting the key recommendations from the CDC, we also have the initial page for the COVID-19 has a number of links for local information as that becomes available from the various entities, the school district, for example, and the hospital, as well as at the statewide level. So as the governor issues orders or the state health officer issues those orders, we're putting that information right there on that front landing page as well.
That's very helpful. I appreciate you doing that. Dr. Ayers, what about information about the school district?
Thank you, Pastor Mike. There'll be several different methods we'll utilize. Over the last 2 weeks, we've mailed letters home to parents. We've used our mass communication system twice in the past week, the texting option. We've issued 2 press releases, and I would share my appreciation with the local media for getting those out to parents and asking us and interviewing us as questions arise in the community. But probably the best source of information is our district website, www.ccsd.k12.wy.us. We have a COVID-19 link, and all of those press releases, any information that we should share in the media will be posted there. Updates will be coming soon.
And Mr. Palazzari, is there anything for the city that should be added?
Yeah, we, as always, if you're looking for information about city operations, our website, gillettewy.gov, is an excellent source. Otherwise, we're very active on Facebook, Twitter, and Instagram. We're also using Nextdoor, which is becoming a very popular social media source as well. We have Gillette Public Access Television. If you have cable television, we are on cable channels 189, 190, and 192. 192 is our government channel. The more updated information is available on that. It's also streaming online at gillettewy.gov/GPA. So if you have broadband access, you can catch those channels. They're on 24/7, 365 days a year. We also have a notification program similar to what the school district uses. We do make that available to everybody. If you go to gillettewy.gov and in the search bar type notification program, it'll take you to that page. And you can sign up for whatever type of city information that you would like to receive, as well as the medium which you would like to receive it, whether by phone, text, email. It's done by a company called Everbridge. They have an app as well, so you can just get it via the app. So that's become very, very popular as well. We also send out information in our utility bills.
Great. And Ms. Castleberry, could you speak to, there's a lot of organizations represented up here on the stage and around town. Could you speak to any efforts that are happening to keep that communication line between the different organizations?
Absolutely. And the one that I'm the most familiar with, so I'm just going to focus on what my level of expertise is. But we have established what is called a joint information system. Sometimes they're referred to also as a joint information center. And so what that is it's a collaborative way for the various organizations to make sure that the message that is being developed and is being shared with the public is uniform and consistent. Another thing that leads to additional anxiety is when people are receiving different messages, especially from their local organizations. And so the Joint Information System, we have representatives from the school district, from Campbell County Health, the city of Gillette, the town of Wright, Gillette College, and of course, public health as well.
Very helpful. I appreciate that. We've received hundreds of questions from viewers and from our community over the past couple weeks, and we've narrowed those questions down to 26. I will ask the panelists to keep their responses to these questions as short as possible, as we'd like to get through as many of them as we can. I'm going to talk about some of the medical questions before we get to the logistics questions, and I'll begin with Dr. Barabbas. The most asked question that we received has to do with tests. And so could you kind of give us an idea of how many tests are available to us locally? And could you tell us who has been tested, maybe how many if you know that, and then also who can be tested?
So approximately 450 patients have been tested in the state of Wyoming. We have had 1 positive here in Campbell County and 24 or so across the state. It is a limited resource, so we do have to choose who gets tested. That involves a strict criteria that has been given to us by the CDC, and that allows us to focus the tests on patients that are truly high risk, those patients that will truly make a clinical difference. It also includes healthcare providers that are at risk as well. As long as we use those criteria, we do have an appropriate number of tests at this moment. As we ramp up testing across the nation, those guidelines, as we've mentioned before, will probably change. But for right now, as long as we stick to the guidelines, we're doing well.
Could you also speak to hospital beds and other equipment that is needed for this? Do we have plenty of those things, and do you foresee us running out of those? And if yes, do we have a backup plan?
So I will tell you that we have an excellent team at Campbell County Health. We have a lot of resources. We have a lot of people working on a lot of solutions right now. A lot of this comes down to that catchphrase, flatten the curve. If we have done our job and we continue to do our job over time, we will be able to keep the number of infections hopefully manageable. As long as we keep ourselves under as long as we keep that curve flat, so to speak, we should have the resources that we will be able to manage all the patients that we do see. If we do not manage to do that, and we run out of resources, essentially we would have to look to outside hospitals to see if they had capacity. If there is no capacity outside of that, then that's when things start to look like Italy and some other countries that ran out of resources, essentially.
Thank you for that. I'll turn to Dr. Khan. So now that we have at least one case in Gillette, a lot of people have asked about, is social distancing an overreaction? It seems to us that making everybody social distance if a few people are infected may be an overkill. Also, could you speak to why everybody needs to do social distancing if it is only a small population of our small percentage of our population that's at risk?
So what I'd like to clarify is social distancing is a call for physical distancing and not a call for social isolation. So we have to sort of create a balance right now to how to maximize the physical distance, but at the same time maintain social connection. And thank God for technology. So everyone needs to utilize technology to FaceTime, Skype. If you have parents, grandparents at Legacy, utilize that. Now, in terms of social distancing and quarantining certain groups of people, this virus does not discriminate based on age, ethnicity, country, state. So this virus affects everyone. And if you look at the recent data in the country, about 20% of the people in the ICU are actually young people, less than 65. And if I were to just speak on behalf of healthcare workers, military people, I know in the beginning we were saying that, okay, this affects people over 60. But, who's going to take care of the people who are over 60 in the hospitals? Just because we have coronavirus doesn't mean other diseases are taking a vacation. People will still have strokes, heart attacks. People are still giving births. Terrorists are not taking a vacation. So you have to protect everyone. And doctors and these people are not machines. They have family members. So if you're mingling with their family members and infecting them, so then you'll be infecting these people who are in charge of protecting everyone else. So we cannot just arbitrarily go and say, okay, we're going to just quarantine this group of people. So we have to maintain social distancing, and that's the only way right now we can flatten the curve.
And Dr. Barabbas, a lot of the questions we got referenced the number of flu deaths we have every year. And every time I hear it quoted, there's a different number of flu deaths that people quote. But they're asking why this reaction to this disease, but we don't do much for the flu. Can you speak to that?
That's an excellent question, because a lot of people, especially on social media, tend to compare the flu and COVID-19. They both have similar symptoms such as fevers, chills, cough, runny nose, but essentially that's where the similarities end. Roughly 10 to 60,000 people die a year from the flu, and that's a very significant number, but it requires tens of millions of patients to be infected to have that number of deaths. Flu has been around for, as we know, for decades, as we know it, and we're very well attuned to treating the flu, and our hospital systems are built around how to take care of the flu. Ultimately, 1 in 1,000 patients that contract the flu will die of the disease. 0.1% will die of the disease. 1% may need to be hospitalized. We have vaccines for the flu. We have medications that work against the flu, and we're essentially accustomed to deal with the flu within the health system. When it comes to COVID-19, we don't have a vaccine. We don't have effective treatments as of yet. It's also more contagious, 2 to 3 times more contagious. And then when you look at the statistics of it, the chance of dying from the COVID-19 ranges anywhere from 1 or 2% all the way up to 15% in some of the hardest hit areas. The chance of hospitalization is 20%. So when you add the numbers up, it doesn't take millions to overwhelm your system, it only takes thousands.
Dr. Khan, a lot of the questions had to do with how contagious it was and when are people contagious. Can you speak to that?
Number 14 is the magic number. So, and like I said before, so as of right now, that is the number we have. It may change, but the incubation period for the virus is about 4 to 14 days. What that means is if you are infected, you can have symptoms after 4 days after infection or after 14 days. So therefore, 14 days is what basically is being recommended for self-isolation or if you have onset of symptoms. Now, there are people who can contract the virus and not have any symptoms. Like I said, it can take up to 4 days or 14 days. Now, the same way, people may have different spectrum of symptoms, mild to moderate and so on. If you extrapolate from that, they can have different rate of shedding of virus too. So therefore, yes, even if you don't have symptoms, you can be contagious.
So if somebody does get symptoms, Dr. Barabbas, I'll ask this of you, what do they do? Do they go to the ER, the walk-in clinic, or some other place? What should be my first step?
Ideally, we'd want you to talk with your primary care provider. Most of these symptoms will typically start off mild, and because of the fear that's out there, it's good to have someone with a medical background to help guide you in that decision-making process. If you contact your primary care provider, they'll be able to triage you as to whether or not you would need to have additional treatment or to be potentially tested. If you had severe symptoms such as severe shortness of breath, then absolutely you would want to visit the emergency room.
And Dr. Glosser, or Ms. Glosser, sorry, we received quite a few questions about what happens if somebody does get it. And so I'd like you to speak to, I know you guys deal a lot with how, when people have the flu and you do tests for that. I was wondering what you would say, how do we treat people who get COVID-19? Do we lock them in a room in the house, and how long do we leave them in there, and how does that work?
Thank you, Pastor Mike. So if somebody in the household does test positive, there is a quarantine that needs to be enacted. So the person that is actually positive does need to stay in a separate part of the house, preferably in their own bedroom, and have their own bathroom if at all possible. The rest of the family is also quarantined at home, so the positive person has to quarantine at home for 7 days and or 72 hours after they've had the fevers, whichever is longest. At that point, they are going to be released from quarantine, but it actually has to be a release in writing from the Wyoming Department of Health. The other members of the family are going to have to remain quarantined at home for 14 days to make sure they don't start developing symptoms. So for the person that is actually positive and has been quarantined at home, like I said, we do prefer them in their own area of the house so they don't have contact with the rest of the family. That doesn't mean that they can't FaceTime with one another, talk through the doors, those kinds of options. We don't want them to feel totally and completely alone, but it is definitely to help prevent the spread within the household. For the person that is isolated, it is very important that they eat nutritionally, so the rest of the household members need to provide their food, preferably on paper plates, napkins, that kind of thing. Put it outside the door, let them know that the food is there, and then have a bag that the paper products can be disposed of by the person that is actually ill. And again, then they need to take care of themselves as far as disposing of their own Kleenex, cleaning their own bathroom, those kinds of options. But mostly we don't want them to feel isolated from their family. They just have to eliminate the personal contact while in isolation.
Thank you for that. And Dr. Khan, we've received multiple questions or statements from people saying they are nervous about getting tested because they don't want to find out they have it. They feel like they would be treated poorly by the community and shunned or even worse. And so I appreciated what you said earlier about showing kindness to each other, and I would assume that also applies to the people who find out that they have this. Could you speak to people who say, I'm pretty sure I have it, but I'm just going to self-quarantine? What medicine should I take if I do that?
So if anyone has symptoms, the first thing I would urge them is to talk to their doctors, because everyone's different. They may have different health conditions, they may be on medications, and even though over-the-counter medications you can obtain without a prescription, you may never know what they can interact with. So it is always, please call your doctor and they can give you guidance. The same way we have criteria for testing, there are criteria for admissions too, so at least they can give you, these are the symptoms you should watch out for. This is when you need to go to the emergency room. The things that you can do safely, please, you need to hydrate. So that's the number one thing. In terms of over-the-counter medication, again, talk to your primary care doctor. They can advise you. One medication that I will say is safe regardless of whether you have cirrhosis or not. You can take Tylenol for your fever, and you can take up to 500 milligrams, 4 tablets a day.
That's very helpful. I'm going to now slightly transition to some logistics questions. We're doing good on time so far. I'll ask Dr. Barabbas, what about going to the hospital for other reasons, other problems come up? Is it safe for me to go to the hospital? And I'd wonder if you would extend your answer and talk about, we've had multiple questions from people who are pregnant. Are their spouses going to be able to be with them and visit other people for other reasons in the hospital?
So we're trying to make it as safe as possible for patients that come into the hospital. There's two things that we're trying to limit or try to avoid by limiting access to the hospital. One is we want to reduce the risk of transmission, obviously, to the patient or to healthcare staff, and we also want to reduce the amount of resources that we're required to use when we evaluate patients. So we're really trying to focus purely on emergent and urgent patients only coming to the hospital. And a lot of the non-urgent interventions or interviews we try to do via telemedicine or telephonics, which we're working very hard at getting set up. We do allow a single support person in with each patient. So for that 37-week pregnant new mom, she would be allowed to have her spouse or her mother or father or sister would be able to come in. But again, we're limiting access. Their patients are also, and family are being screened at the doors to try to confirm that they do not have signs or symptoms of an infection, again, trying to limit the spread.
That's helpful, and I know many people listening will be happy to hear that. We've heard a lot of feedback, not necessarily questions of people who wanted to promote the idea of telemedicine. What about, Ms. Glosser, at public health? Can somebody come in for a flu test or for other reasons that you guys normally serve?
Yes. So what we have done, and we're going to begin it tomorrow, we have changed our services to some of the times that we offer them to protect the health of the staff and also the health of the people coming into the building. So currently, you could walk into our office between the hours of 8 and 12, 1 to 5, and receive a strep test, have us look in your child's ears, just those health screenings. And we are going to move those times to 1 to 5 in the afternoon to give our staff time to still see their home visits, their home patients, and then because we expect to be busier during the day. Another thing we are doing is that we have set our mobile clinic unit up outside of our entrance. And we are asking that anybody who is coming to go into the building, please stop there first. And we are going to do a screening, just some questions, and check your temperature, because if you are ill, we are going to, if you have any of the triggers, we want to go ahead and refer you right then and there to your provider so that you can find out what you need to do and not have people coming into the office. So please stop there first. On Wednesdays, which is our normal immunization day, we typically only do those immunizations in the morning, and it's a walk-in basis. We are going to extend those hours from 8 to 12 and 1 to 5, and we are going to be taking appointments. So if you could please call us and let us know that you would like to schedule an appointment, we will do those shots, because it's very important we continue immunizing the children in the community. Otherwise, we're putting them there for other risks. So if you do happen to come and there's already an appointment filled, we would just give you the next available appointment, and either you could come back or wait in the parking lot in your vehicle. So we are going to be running those at 15-minute increments. And during that time, so on Wednesdays, we're not going to have our normal walk-in clinic so that we can protect those babies that are in our office from being exposed to illness. So there will be a complete list of how we have changed the times of our services, and those will be out on our county website. And if you have any questions, just call the office and we will be able to help you with those questions.
Great. As we continue talking about the services that are available ongoing, Mr. Palazzari, could you speak to first responders? Are they still working their normal hours? Are they in any danger, and what steps are being taken to keep them safe?
Sure. I can only speak for the Gillette Police Department, and maybe anecdotally about a couple of the other ones. But as far as the police department, they are taking steps to protect themselves. If potentially a call can be taken care of or over the phone, they will attempt to do that. But if somebody needs a police officer to respond, they will respond. If appropriate, they will practice social distancing to make sure that we're keeping the proper distance away. But if they do need to act, they will. If you call 911, a dispatcher will answer the phone. If you need a police officer, they will respond. I get a daily email from the fire department. The media gets it as well. Doesn't look like their call load has decreased at all, so I'm pretty sure the fire department is doing as well. And as far as what's being done, like I said, we're taking steps to make sure that our officers are staying as healthy as possible, as well as their families.
Ms. Castleberry, could you speak to? Oh, go ahead.
Can I comment
Yep. Chairman Reardon. Yep.
I don't know if there it goes.
Yep.
I'd like to add to Gino's comment on that. The Sheriff's Department is doing similar to what the Police Department's doing. However, the Sheriff's Department has more activity of people coming in to see people that are incarcerated. The Sheriff's Department is limiting that and modifying that of how people can come into the building. But I would echo what he said on the fire department. The fire department is there, they're manned up. The office is closed. You have to be buzzed in if you want to go into the fire department, and they go through a similar screening process as you would if you were going into the hospital or somewhere else. But it's fully manned up, and they are responded to calls.
Great. Ms. Glosser.
If I might say, in public health, we have been doing briefings with many, many local agencies, including law enforcement and fire, both Gillette Police Department and the Sheriff's Office, and we have worked very closely with them, making sure that they do have the proper equipment and helping them with those questions that they might have so that they are all protected.
Great. Ms. Castleberry, could you speak to the courthouse? Is it remaining open, and can you speak to what happens if somebody needs to come in for a marriage license or renew a license plate?
So one of the things that is on the agenda for tomorrow morning is that the commissioners are holding a special meeting, and what it looks like, of course I can't say until the resolution is actually passed, but it looks like they're planning to close the courthouse to the public. And what that means for those people who have essential business that needs to be done, that we will have special arrangements, in particular with our courts, both the circuit and district courts. They're responsible for ensuring that people's statutory and constitutional rights are protected. Those don't go out the window just because we have to make adjustments in order to protect the public. And so our administration has been working very closely with both circuit and district court so that we can ensure that attorneys and litigants and members of the essential members of the court staff are able to be there to address people's needs as they come up. As far as marriage licenses, titles, recording documents, last week, several of our departments, they implemented the use of drop boxes, so people who didn't want to have to come in, they were able to drop those off, and then the staff from those offices would gather the documents and proceed with them as they would if somebody had been in there themselves. And so what we would see is those options would still continue to be available. People can use, for example, with the treasurer's office, if they're trying to renew plates or pay taxes, all of that is able to be conducted online. And if somebody wants to get a marriage license right now, the one thing that the clerk's office is asking is that they would please call ahead. They definitely want to have that on an appointment-only basis. So we definitely have a number of steps in place that would allow the public's business to continue to be conducted while doing so in a safe and effective manner, as well as one of the changes that we're looking at possibly implementing is that the commissioners' meetings, as most people are aware, those are streamed live, putting some systems into place so that people can email questions for their meetings, because again, the county can't just stop conducting business. We have to be able to continue doing the public's business.
Great. Dr. Ayers, we know that some school days have been canceled. One of the questions we received a lot are about kids that rely on school lunches. Can you talk about, we know that an announcement came out about something that's happening with those. Can you talk about that?
Absolutely, Pastor Mike, and I've been informed that I had a microphone issue earlier in the evening, so to the question about where to go for information, including food service, please visit the school district's website and our COVID-19 link. To your question about serving meals to those in need, we're actually going to serve both breakfast and lunch to all young people 18 years and younger. We'll begin that service tomorrow and through the extended spring break over the next 2 weeks. Those meals will be served from 9 a.m. until noon. Both meals will be provided in the grab and go that each student will receive. The following schools will host those deliveries: Hillcrest, Pronghorn, Stock Trail, Prairie Wind, Cottonwood, and Rosette. At this time, the student does need to be there in person. No paperwork is required. We'll be serving those meals from a school bus outside. We would ask everyone, students and parents alike, to respect social distancing guidelines. We're looking at the possibility of expanding our service over time if the need arises. You cannot consume the meal on site, unfortunately, so we would ask folks to come and get their meal and then wish them the best throughout their day. The government is loosening their guidelines on meal service requirements, and so that's changing day by day, and so we'll adjust and change our approach as we need to. I can't leave this topic without mentioning Blessings in a Backpack. There was a great article in the News Record today. Pastor Mike, both your church, and of course, Ellie and Jen do a great job serving our kids on the weekends. For those that don't know, many students, 800 plus, leave with a backpack every Friday and bring it back Monday. It sounds like that communication will go out on Tuesday. We're happy to help as a school district in communicating for you if you need, but we truly appreciate that service to our kids, and we know there are kids that depend on that and families that depend on those backpacks every weekend. So we're pleased that you're able to continue to do that during the closure, and we're here to partner with you, so thank you.
I appreciate you saying that. One follow-up question that I see just got texted in. You said 18 and below, all kids. Does that include kids that are not enrolled in the school district?
Yes.
Okay.
Anyone 18 and younger, and I failed to mention, it's regardless of free and reduced lunch status, and it doesn't matter where your attendance area is. You can go to any of those 6 sites and pick up that breakfast and lunch.
Great. Chairman Reardon, I'm wondering if you would reflect on how you feel like our community is doing in following the guidelines that have been put out. And I'm also curious if you would reflect on your agreement with those guidelines.
Certainly. I think the social distancing thing is starting to catch on, and I think it's starting to catch on primarily because of the governor's orders. By closing restaurants and bars, it's kind of forced the issue that people aren't spending time in those establishments. I don't think that everybody is taking social distancing as serious as we need to. As Dr. Kahn said, we need to flatten the curve, and if we don't flatten the curve, we're going to be in a real crisis. So I think as the crisis hits closer to home with more positive tests, it will get people's attention, and they will start taking that more serious. But overall, I think social distancing has been adhered to, and people are starting to practice it more and more. Even as this panel sits here, we're 6 feet apart. Meetings that I go to, we're 6 feet apart. I go for a walk and people run around instead of right by you. So I think for the most part, people in the community are very aware of it, and they're starting to practice it more and more as the crisis hits closer to home. And I didn't catch the second part of your question.
I was just curious about your feelings about those guidelines, but it sounds like you are in favor.
Yes, I'm very much in favor of it. Anything that can flatten the curve, so to speak, as Dr. Kahn has said, is going to help this community and help us come through it a lot quicker than if we just ignored it and continued to go to the bars and the restaurants and, spend time together in close places. So you go to the grocery stores, which are still open. There's still a lot of people in there. And I'm even starting to notice where people are starting to separate themselves, and as you're walking down an aisle, somebody might stop at the end of the aisle and wait till you clear before they come in. So I think it's in the back of everybody's mind.
You referenced the closure of the restaurants. Are there any other closures or changes that you would like to announce? And are there any standards that we've set as a community that are different than the standards that are set of Wyoming that you know of?
No, the county commissioners are trying to adhere closely to the CDC and the public health and what's mandated or passed down from public health through the state. The closures of the restaurants, and I would like to make a plug for the restaurants, they're doing very good at adapting to that. Restaurants are offering carry-out food or curbside service. There's a few that haven't or couldn't or have chosen not to, but I think the restaurants are doing a very good job of adapting to that. As an example, I was down by Pokey's yesterday and just reading the sign on their door. I hadn't ordered anything, and I was there for a couple of minutes, and one of the young ladies that was inside opened the door and said, "Can I help you? Do you have an order?" So I think they're really doing a good job, and I think that's the case with most restaurants across the town. And I commend them for that, because we want the restaurants to stay in business. We want them to come out of this crisis at the end and be ready to go right back to work with, walk-in business and the things that go along with that. So I think they're all doing a great job.
Absolutely, and tip well, right?
Tip well.
Tip well, yeah. We placed our order that we usually place for Pizza Corella last night and didn't even have to tell anybody anything. We just drive up and pick it up and don't have to go inside or anything. Yep.
Well, and that's the other thing is, I think there's a lot of people that are supporting the restaurants by calling in carry-out orders, even more so than what they may have been doing before. So, I've heard one person in the community that says, "My wife has refused to cook as long as this crisis is here. We're going to carry out every night to support the restaurants in town." So that's a commendable and a great idea.
So on that topic, I'm wondering if you could talk about how it's affecting us, how it's affecting our economy specifically. And I know we had many questions about how do we support our economy in this time. Is there any opportunities we have for that, or maybe volunteering opportunities that you know of?
Well, everybody knows that this crisis is going to affect the economy of the United States. If you haven't looked at the news or heard the news, the stock market is crashing, everything's going down around us, but we can do things to help support that economy, like I just said, eating out or ordering out, if you will. We're supposed to be social distancing, but people will fill up their car and go for a drive, not with a whole carload, but go for a drive. There's different things that people are doing, and I think that's going to be helpful in bringing the economy back when the time comes. But it's definitely going to have a negative effect for a while, but we need to do everything we can to keep businesses going, keep the economy flowing as best we can, and when things settle down and we get through this crisis, I think it'll really take off again.
Amen to that. We say Gillette strong.
That's right.
Mr. Palazzari, I'm wondering if you could, did you have something, Ms. Castleberry?
If I could just add to the chairman's comments there, in addition to the restaurants, we have a number of local small shops, and we'd really encourage people to reach out to them and call them. Perhaps they're putting stuff on websites that you can order off of them. Maybe if you call them, they can put an order together for you that they can meet you at the door with. Also, the other thing you can do is you can pick up gift certificates. What a great way to be ready to go out and and crowd the stores when we're back to that opportunity. But I think that those are some other things that we can do to really help support our local businesses beyond just the restaurants as well.
Great. Mr. Palazzari, the next question is about some power outages that have been happening recently. I'm wondering if you could address those and explain them. Do they have anything to do with COVID-19?
Sure, no, they had absolutely nothing to do with COVID-19. Our electrical services crews are fully staffed, and as many of you had witnessed, very quick to respond when we did have those outages. There were a number of different issues that came up, and unfortunately, they kind of coalesced around last week. Part of it was out in the Westover area. We had some older cable. The way that was installed many years ago, it was direct buried. It's been in the ground for a while. It is starting to fail. We do have a program to replace a certain amount of that every single year so that we can have it in a conduit. This happened to be a piece of that older cable. It did fail. We went in, we repaired that. It was a smaller outage. The other ones were weather-related. There was some icing on the main feeder lines that come into our community. The first one, I believe that was on Tuesday, was for the north, happened to be on the north side of town. And as the ice was forming on that, wind picked up, it caused the lines to slap into each other and lost power through that. They were able to reroute power through our south feed until they were able to repair that. Unfortunately, it did affect around 5,500 people with that one. Had another one out in Westover area later that Tuesday. I believe it also affected West Ridge, Hidden Valley, Pronghorn Ranch. That happened to be a piece of equipment, a switch cabinet failed. And whether that was related to the previous outage or not, looks like it may have been damaged last summer, and there was a piece of equipment in there that failed when we re-energized that line. As far as what happened on Friday, similar situation as to what happened on Tuesday. It happened on our south feed. Once again, there was ice on those lines. Just happened to be the condensation that was in the air. Temperatures were just right. And I believe what happened with that one is ice was starting to melt, and as it was dropping off, the line started to gallop. And I've actually got some video, and we'll post some of that on our Facebook page on Monday and some other social media sites. But you can see the cables going up and down, and once again, slapping together caused that to go offline. Now, later in the day, what ended up happening in the Remington area, as our crews were inspecting the lines, they saw that one of the high voltage lines had broken and had fallen down on some low voltage lines that were serving the Remington Estates area. Made the decision to shut that area down so that they could facilitate the repairs. As they were bringing them back online, some GFCIs activated or shorted out within one of the apartment buildings there. So the fire department was called. All of those apartments were inspected, found to be okay. But again, it was weather related as to what happened with those situations as well. So we're hoping that as we have these warmer temperatures, temperatures stay above freezing, we won't have any situations like that moving forward.
Good, I appreciate it. We were talking about the economy, people getting laid off potentially and things like that. I'm wondering if there are any steps to be taken to make sure that people's power's not turned off in this time.
Sure, yeah, no, we have suspended all utility shutoffs. We are still collecting data. We are still going to be sending out bills. However, we are going to be waiving late fees, and we will not be sending any disconnect notices, but we will not be going and disconnecting utilities until this situation is taken care of. And as always, if anybody has any questions about that, by all means, please call our customer service office, 686-5206. And we have customer service representatives that will be answering the phone during normal business hours, Monday through Friday from 8 a.m. to 5 p.m.
Good. And I was wondering if you have any idea, one of the things that is causing the most panic is the lack of ability to go to the grocery store and pick up what we need to pick up. Do you have any idea of how that's going on a local level? Are those stores getting restocked? And anybody else can speak to that one too if you have insight.
I don't know if I can speak to anything specifically about that. I've talked to family members and friends that live throughout the nation, and they don't seem to be having some of the same problems we're having here. So I honestly, I believe that our stores can keep up. I have been out when we've needed supplies. I have been able to get what I've wanted, maybe not right away and maybe not the brand that I wanted. But I do believe that things will get better. I'll make the same ask that everybody else is out there. It's like, please only pick up what you need. Make sure that there are those people that need to shop more frequently, whether they're low income or they just don't have the time to get out. So make sure that there are still products available for those individuals that maybe cannot pick up large amounts at one time.
Good.
So,
Chairman Reardon.
Yeah, I would like to comment to that, and actually I did check on this Walmart in this particular case and asked them, and they're getting 6 to 7 semi-loads a day, and they're unloading them, and as soon as they unload them, one of the stockers, I talked to them, they were even wondering why they were bothered putting stuff on the shelf, because it's flying off the shelf just as quick as they put it on. In some cases, as they're putting it on, people are taking it right back off the shelf. So their deliveries have not changed at all. They're continuing to get deliveries. I am going to put a plug in for Council of Community Services when this whole crisis is over. I hope the people that are stocking up take all of that excess that they've stocked up on and take it to the Council of Community Services and donate it to the food bank and the soup kitchen, because they really do need that down there. And I think people are just panic buying at this point in time.
Yes, it seems to be right. And why toilet paper? That's what I don't understand.
Yeah.
Why everybody needs so much toilet paper. We're going to transition and just ask a few questions about the schools, and then we've got a lot of good questions coming in online that we'll transition to after that. Dr. Ayers, could you tell us if you have any sense of canceled school days? Is there a plan about making those up, or are those just canceled?
Thank you for that question. The State Superintendent of Public Instruction, Jillian Balo from Campbell County, she made a decision and used her statutory authority last week to not require those days be made up. She reduced the number of operational and student days for any calendared school days through April 3rd. And so in that case, we will not be making those days up. We've extended our spring break for an additional 2 weeks. The end of our calendar remains the same at this point in time, including graduation. We've had several people call and wonder about that, have family traveling in. And our calendar at this point is the same. Graduations are the same. Westwood is on May 14th. Wright Junior Senior High, Thunder Basin, and Campbell County High School are all on the Sunday the 17th. But we don't know what the future holds in terms of travel, large gatherings, and so forth. So it's a bit difficult to answer that question. I will say that our seniors are going to finish the semester, and they will graduate. I know a lot of them have plans that extend from June and beyond. One thing that makes us feel a bit better about the situation we're in is that both the federal and state government have issued waivers for state testing. So YTOP will not be given in Wyoming schools this year. So we spent a great deal of time planning and taking that assessment, and that simply won't take place during this school year.
Can you speak to the availability of online schooling at all? Do we have the capability, if it becomes necessary, to do online classes?
So that's the next challenge ahead. Of course, the last week was about canceling school, food service, extending spring break as a first measure. We were very intentional in not providing online education over the course of the 2 weeks I just mentioned in terms of extending spring break. There are some real equity issues and some federal law that schools must follow, including access to the internet, devices, serving students in special programs. If we provide education and we can't do the job we're required to do for all students, we have some potential liability in that case. And so our work has shifted towards the end of last week and going into next week and preparing for online or remote education for our students should the closure be extended beyond April 6th. We have a team of our instruction, curriculum, and technology folks working on that now, and we'll be engaging our staff once we're ready to roll out a plan here in the coming days for that possible event on April 6th,
And
not knowing what might happen.
And do you have a sense of, you were talking about your staff, do you have a sense of if campuses may potentially be totally closed and they are asked not to come in?
So at this point, we have currently closed our schools and our departments to the public. Only workers that we've deemed critical will be working throughout the next 2 weeks. We are following social distancing guidelines with our staff. Most schools will have 1 or 2 custodians, someone to answer the phone, and that's about it. We'll be able to respond to emergencies throughout that time period. We're having folks work from home, which has been a new challenge for us, but I think it'll tell us a lot about what we might be able to do should this continue. And we're planning for what might happen on April 6th, whether we're back in brick and mortar schools or if this closure should be extended.
We're receiving a lot of follow-up questions about things that may be closing. For example, I see a question here about beauty salons and county employees. I'm wondering first, Chairman Reardon or Ms. Castleberry, do you know of any county employees that will be asked to go home and not come into work in the future?
At this time, we anticipate that all the employees will still be reporting for work. There may be some adjusted schedules. Again, this is conversation that the commissioners are planning to have tomorrow, but we might see things where the employees are working in different shifts as an attempt to ensure some continuity of operations should someone become ill. But at this time, all of the departments, even if they have closed facilities, those employees are still working, and we will continue to work. As I mentioned earlier, those services that are delivered, especially from the courthouse, we can't stop delivering those services, and so we have to find ways to continue to offer those services, which requires employees to be able to do that as well.
Okay.
Actually, excuse me.
Yeah.
I can actually speak to the beauty salon. We received that question a couple of days ago. I checked with our police department, and they reviewed the governor's order, and beauty salons are allowed to be open. There was nothing specific in the order that said that they were not to be open. However, at the same time we were answering that, the next order came out that said that we need to make sure that we're not gathering in 10 or more. So need to make sure that you have less than 10 people within those areas. So.
And along with that, that includes the employees of the salons. So patrons and employees cannot be more than 10 in a facility such as a salon.
That's helpful. One of the questions that I see here, I don't know the answer to, is can I get COVID-19 twice? And I'll point that to Dr. Patel. I don't know if can I get COVID-19, get over it, and then get it again?
Well, there's a lot about what we still don't know about this disease. Means, yeah, we get it once. We haven't had known this disease for long enough time to know if you will get it again. So as far as I know, there is no knowledge out there. I'm not sure the other physicians are aware of getting the COVID-19 in, in South Korea, or one place they are saying there's a resurgence of the disease again. Is it just more people are being found to be exposed, or the same people are getting it? I'm not aware of that. So.
Dr. Barabbas?
So just like he said, there's a lot of things we're learning about it. There is a report of potential reinfection with a different strain of COVID virus, just like how you have different strains of flu. But for the most part, the thought is that once you've been infected and gotten over it, you should be very safe.
I saw one question on here about quarantining. If somebody is quarantined, does somebody check up with them? Is somebody checking in with the people who are found positive? Maybe Ms. Glosser? Yep.
Yes, thank you. Your local public health agency, so depending on whatever county you're in, your local public health agency, so we are working very closely with the Wyoming Department of Health, and yes, we check in twice a day, actually, with anybody who is positive. and we have a list of questions that we go through with them about themselves and then anyone else in the household. And we are closely monitoring that situation, and we will call for 14 days, twice a day, anybody that is in quarantine.
Thank you for that. We've heard multiple questions, and I'm going to ask anybody who wants to answer to this one to raise your hand. But we've had multiple people ask the question. You say call your provider or your healthcare provider or your care physician. What do you say to the people who don't have a go-to physician or doesn't have somebody to call? Is there a place that you can go to just ask a general doctor for information about how they should react if they have? Dr. Patel.
Okay, the hospital has set up a phone line that is manned 7 a.m. to 7 p.m. It's a 688-1000 is a phone number.
688-1000.
1000,
Okay.
Right, Karen? So that is a number that they can call. There's an algorithm where they screen patients and they will direct them to registration if they're eligible. Right now, as we mentioned earlier, that we don't have enough tests. But if there's any reason for people to believe that they have been exposed or they might have it, recommendations from public health point of view are that please try to self-quarantine yourself till the symptoms improve, because testing is still very limited.
Great, and I'm going to speak, the final question that I'll ask is to do with the length of this social distancing, the length of how long, the CDC is, I think it's 15 days is what they're saying. What are the odds that this thing, at the end of the 15 days, we all get back together and boom, giant spike, and we did nothing, it didn't really help anything? Dr. Brabus, I'll ask that one to you.
So I would hope that most people understand that this is going to most likely last months rather than weeks. One of the things that we learned in the 1918 flu pandemic was in Denver, for example, they restricted their social contacts, and that resulted in a lower mortality. And as that mortality was going down, they said, hey, we're doing well, let's let off of the gas, so to speak, and things got significantly worse again. I do expect that this will be sort of a new norm, potentially for many weeks, if not for many months.
Thank you for that. And I thank you to those who joined us online. You sent in a lot of good questions, and I didn't get to all of them, but I think we hit pretty much most of the topics. Please stay informed. Go to those websites that were mentioned throughout to stay informed as much as you can. Keep the social distancing thing happening. Do what you can to help your neighbor. Love your neighbor in every way you can. And again, we are doing a blood drive here at New Life over in our youth building, The Landing, on Wednesday and Thursday of this week. You can go to newlifegillette.com for more information on that. Thank you, panelists. Thank you for leading our community. We will continue to pray as you lead us. We know your time is valuable, and you took some time out to be here with us today. Thank you for that.